Assalamu alaikum everyone. Welcome to Medical Education Nepal. In this video, we are going to discuss about how you can perform better in your written examination. Okay, so first of all, I would like to give you a basic outline of the marking structure of the examination written, and the entire 100 marks examination. You have your first 20 marks, it's MCQs, okay, multiple choice questions. You got your 20 to 30 minutes of your written examination. You have to solve that, and after that comes your 70 marks SAQ, short answer questions, in which there are various small questions as well as long questions, and also includes your short notes, okay, which is very important. And after that you have your 10 marks formative examination. This formative depends upon your item cards, okay, how you have given your items, what marks have you got, okay. So in this video we are basically integrating both how you will prepare for your terminal examination as well as professional examination. Both are kind of same, okay. And for that I have divided this entire video into two sections. One is the questions. So how are the questions coming in your term examination or in your prof examinations? Are those past year questions repeating or not? What is the tendency? What is the pattern? Okay, I will discuss that. And in the second half of this video, I will discuss the small tricks and tips how you will get better marks. Okay. Okay, so let's come into our first point. The thing is the questions. Okay, so generally I have seen for terminal examinations, usually the teachers used to just print out their past year's questions, your seniors questions. They used to, maximum questions are printed out. I've seen in most of the universities, most of the medical college, including mine. But again, there's also some new questions are added, and those new questions are for, for getting the better marks, okay, who will achieve better, who will perform better. And basically you will see, like in my medical college, I have seen like lots of questions have been your what do you say, repeated, okay. And I have this question of this Dhaka University. I have just solved of this Dhaka, just given my second professional examinations, and talking about the professional examinations. So professional examinations also maximum questions are repeated, okay. So in short, if I have to tell you, then first of all, if you are looking to prepare for your written examinations, you have to definitely solve the past year questions, okay. And after that you can go and solve the matrix chapter wise, each and every questions. But the thing is, the questions is not necessary to come from the Dhaka University, okay. The question can also come from Rajshahi University or Chittagong University, or even some new questions can be added, okay. So for terminal examinations, this is the thing. You have to just go through your past questions, and if you get time, then you can look after your matrix questions, okay. And talking about the professional examination, okay, I haven't brought my mobile phone, otherwise I will have shown you the thing. The Dhaka Medical College, yeah, the one of the best medical college in Bangladesh, and I have gotten the questions paper of their terminal examinations, and somebody had told me like most of the questions have been repeated, and from the past year questions, and if some new questions is to become, then the new question is maximum your Dhaka Medical College or Maispin Singh Medical College. Their terminal questions are usually coming in the professional examinations, and I was very much shocked and amazed. I saw the questions of, I was very lucky that I had already practiced the Dhaka Medical College questions, and all the short notes. Okay, let's look at this my professional examination question paper, the like air embolism, deciduous teeth, okay, like then decomposition artifact, secreted and non-secreted. So these are some new questions that have meant like very rarely even asked, or even never have asked. This like secreted and non-secreted, this is like post-graduation questions, okay. But if you are from Dhaka Medical College, or if you have got the like question paper of the terminal examinations, all these questions are similar. Okay, all these questions have been taken from that. Okay, so this was my experience for forensic medicine. Okay, the Dhaka Medical College, the new questions of the professional, the Dhaka Medical College, they have been taken from. Okay, but in case of community medicine, I had assumed that maybe here also the things will be repeated, but no. The Dhaka Medical College questions were not repeated. Okay, their new questions have been added. So it's not necessary that the top colleges, their medical, their questions, terminal questions have to come. Okay, but you have to, for your preparation, you have to look into each and everything. If you want to perform better, you want to get the highest mark, then definitely you have to go through each and everything. You don't have to leave anything behind. Okay, for your preparation. So in summary, if I have to summarize the first half of this video, where the questions, how you will understand the question pattern, then first of all, you have to go through the past year questions. After solving that, you can go through your matrix, you can go through your guide and look into another university questions, look into some new questions which has been given in the guidebooks, you know. So this is the thing, okay? And now the second half of this video, how can you like get the extra marks? Okay, how can you write better, perform better? So for this I will like start from the smallest point. Okay, the smallest point is, after you solve your MCQ, after solving your MCQ, you get your like question like your answer sheet. Okay, suppose this is your answer sheet. So what do you all do? In professional examination, your answer sheet, it doesn't consist of any kind of lining. Okay, and so do my medical college, they also don't give any lining, so that we can prepare for the professional examination. We have to give the lining within the time limit. Okay, so the very first thing we have to do is lining. So I usually used to do first one lining here and then another lining is here. Before that I used to do three linings, one on the left, one on the right, and then on up. But due to lack of time, I have reduced into two, one on the left and then one on the top. Top is the must, you have to give it. Okay, so this is the one thing. Now the second thing is, you come to the question number one, how will you write it? So the very best way to write is, you have to just give the upper in the upper heading bar, you just write answer to the question number, suppose 1A. Okay, so in this way you can write. And definitely I will suggest you to use double pen or triple pen, even triple color pen if you have. Okay, for writing answers you can use black pen. For giving the headings you can use blue pen. Okay, before I used to use three pens, one green pen also for writing the heading, but again due to the lack of time and due to so much writing, I have reduced into two color pen. Okay, one is the black and one is the blue. So I used to write answer to the question number 1A, suppose this, and with the blue pen, and then suppose 1A question. One number question is, okay, define forensic medicine. I'm taking from here, define forensic medicine. So what I will do is, I will make a square, a box as a like heading type, and I will write forensic medicine with blue pen. Okay, and then I will give a arrow mark, and then I will start writing with my black pen. It is a branch of medical science that deals with the application of the medical knowledge to aid in the administration of justice. Okay, in this way I will write. Okay, I have talked about the lining, I've talked about the use of multiple color pens and how you will write it. Okay, now if you, there is another way also you can perform, you can make it more better. How can you make it more better? The first question was, what is forensic medicine? So can't you write forensic, you know, forensic medicine is the branch of law medicine. So why can't you just give it, okay, answer to question number 1A, you can make a law medicine and you can give two arrows, like you can making a diagram. Okay, two arrows, one is forensic medicine, one is medical jurisprudence, and then in downward you can write, okay, forensic medicine, it is the branch of medical science that deals with the dash dash dash. Okay, so what you're doing here, you are just making sure that you will definitely, teacher will look into this, teacher will feel like, oh, he's done a very good job, and then you have given some extra thing, you can make him tabulations, you have given figures and diagrams, and in this way you can definitely gain the extra marks. You will not be losing any marks. Okay, so and in this way you can make your impression very better. The teacher will see, oh, he is writing very good, he is using tabulations and the diagrams and all that. And so teacher will, what his mindset will become like, okay, his paper is going to be very good. Okay, so in another question, if you have written very less also, then also the teacher will definitely give you a very good mark. Okay, so this was the thing of 0.8 marks. The second question will be of consist of either 2 marks or 3 marks. Okay, so for how most of the students, they ask like, okay, Dada, how much do you have to write for 2 marks question, or how much we have to write for 3 marks question? Means how many pages do you have to fill? Okay, listen, the thing is, it's not about the pages, it's about your content and how you're presenting your paper. Okay, you must have to have at least average good handwriting. Okay, that is a must, you need to have that. And for that, you just what is if you got time, like second question, write down the indications of magistrate inquest. Okay, so we know inquest. If you get time, you can just give inquest types: police inquest, magistrate inquest, coroner inquest, and then you can start like indication for magistrate inquest: death in police custody, death in prison, under police firing, exhumation, post-mortem examination, and all that. Okay, so you are just giving something extra, like you indication of magistrate inquest. What you're doing, you are just giving classification of inquest, and then you're giving the indication for magistrate inquest. If you do this, definitely you will get what do I say, you will definitely, teacher will look into it, it will be a very good impression. But again, you need to have a very fast handwriting speed, and my speed is really fast. Okay, my handwriting speed is very fast, and for that I'm able to write this extra things. Okay, so even if you're not able to write those extra things, there is nothing to be worried about. Okay, you can just write down the indications of magistrate inquest. Okay, if you're not got time. One thing is, I like in group A and group B I do very well. Okay, but again in group C and group D, what happens is, due to lack of timing, okay, due to lack of timing, I just give the exact answers. I don't try to add much of the thing. But one thing there is, in the prof examinations, okay, usually the paper are being checked by external also, so the group C and D, usually in my college, it's group C and D are usually checked by the external, and A and B are checked by the internals. So try to prefer that you start from the group C or group D, and your paper must be like very well presented. Okay, the less cuttings and you and all you do, the better your presentation will look. All right, so like here is a question, like define hymen, what are the types of hymen? So if you can give the types of hymen along with the figures, okay, the type of the hymen: septate, perforate, imperforated, vertical, claviform. You can draw the hymens from the forensic the book, Dr. Reddy book. You can see from there, and if you give those figures, definitely you are going to get a good marks. Okay, and for like talking about spaces, you can have like extra sheet of paper, there's nothing to worry about. You can use as much space as you want, but don't write, or the teacher don't like, you write up to the last point. Don't write, leave at least some space down there, so the teacher can give like marks and write those markings. Okay, so now talking about short notes. Okay, short notes, what you can write. Suppose here it's given intersects. So what you can write in short notes, rather than writing an entire page of short notes, what you can do, you can divide the section. So intersects, you give the topic, you write answer to the question number dash, topic intersects. First point, definition: intermingling of sexual characteristics between the two sexes is known as intersex. Okay, after that, what you can write, types of intersex. Okay, there is one more thing. presentations or forms of intersex, okay, physical form, sexual behavior and all that. And after that you can write that types. What you get in type: there is a gonadal agenesis, gonadal dysgenesis, and then there's true hermaphroditism, false hermaphroditism, pseudo. And again there, yes, gonadal dysgenesis is there, is Turner syndrome, Klinefelter syndrome. These are very important. If you mention this point, you can go through each and every you touch each and everything, then it's much better. Okay, you will definitely be getting a very good marks in that. All right, after that, if we see okay, there's nothing much I can say regarding this. So what, in summary, if I have to tell, I talk about the linings, I talk about like using multiple panes and use giving the headings. Okay, Acha, one more thing you can do after you finish your question. Suppose you finish your question number 1A, 1B and 1C, you have finished or completed in like 2 to 3 pages. And after that, what you can do, you can give an ending line. How can you give an ending line? One line you gave, in middle you gave a 0, and again this line, what happens, the teacher will easily understand, like, okay, this is separating. It's the thing is, the more simpler you make it for teacher to understand, the better it's your presentation will be. Okay, the better your marks will be. All right, so these are the things that I consider are important for written examinations. And if you follow these things by heart, and definitely you will be finding like you will be getting very good marks in written examination, or even you will get the highest marks in written examinations. Okay, so these are the tips and tricks from my side. All right, so thank you everyone. Assalamu alaikum.